This solution is used to prevent 4 catheters from getting blocked and to remove any remaining medication at the catheter site. It is important to use this product as directed by your healthcare professional. The dosage and timing of administration will vary depending on the individual's medical condition and response to treatment. Always consult with your healthcare provider for the best timing to take this medication. When using this product at home, it's important to learn all preparation and usage instructions from your healthcare professional. Before using, make sure to visually check the product for any particles or discoloration. If you notice either of these, do not use the liquid. It's also important to learn how to store and discard medical supplies safely. It's recommended to use this medication regularly to get the most benefit from it. To help you remember, use it at the same times each day. If you notice any signs of an infection near the catheter site, such as tenderness, pain, swelling, redness, or warmth, make sure to inform your doctor. Some mild irritation at the injection site may occur, but this usually does not last long. If it persists or becomes worse, it's important to let your doctor or pharmacist know. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience any serious side effects. While it is rare, a very serious allergic reaction to this drug can occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, it's crucial to seek medical help right away. It's also important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, it's important to contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using Aquastat 0.9% sodium chloride injection syringe, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to any inactive ingredients in the product. It's important to discuss your medical history with your healthcare provider before using this medication. If you are planning to have surgery, it's essential to inform your doctor or dentist about all the medications you are currently taking, including prescription drugs, non-prescription drugs, and herbal products. It is considered safe to use Aquastat 0.9% sodium chloride injection syringe during pregnancy and while breastfeeding. However, it's always best to consult with your healthcare provider before using any medication during these times. When using Aquastat 0.9% sodium chloride injection syringe, it's important to be aware of potential drug interactions. These interactions could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's important to always consult with a healthcare professional before making any changes to your medication routine. If someone has taken too much Aquastat 0.9% sodium chloride injection syringe and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the US, residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. This medication should only be used as prescribed by a healthcare professional. It is important to follow the recommended dosage and not share it with others. Remember, it's crucial to take each dose of this medication as directed. If you happen to miss a dose, make sure to consult your doctor or pharmacist immediately to establish a new dosing schedule. Let's talk about the uses of Aquastat 0.9% sodium chloride injection syringe. This medication is commonly used to replenish sodium and chloride levels in the body, especially in cases of dehydration, fluid loss, or low salt levels. The dosage and timing of this medication will vary depending on your specific condition, so it's important to follow your healthcare provider's instructions closely. Always consult with your doctor or pharmacist to determine the best time to take this medication and the appropriate dosage for your individual needs. It's important to store Aquastat 0.9% sodium chloride injection syringe at room temperature and not freeze it. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard it when it is expired or no longer needed. If you have any questions about how to dispose of it, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.